Now, V-shaped face is often known as the ideal of beauty in Asia. Is a V-shaped face the ideal face shape? Join me, Dr. Teo Wan Lin, on this episode of Dermatologist Talk's Science of Beauty podcast, where I share my perspectives on skincare, beauty trends, and the latest dermatology news. Today, I'm going to be talking about Asian beauty trends and faux pas with Chelsea, who's got some questions for me as well.
That's right. I actually remember someone telling me that the ideal face size is one that's, wait for it, smaller than the size of your own hand. I came across Korean Golki Therapy, a method of remodeling the face and body through unique bone massage techniques to realign the bone structure. What are your thoughts on that?
In terms of Asian beauty trends, I think that one of the strangest would be Golki Therapy, whereby the therapist actually uses a lot of manual force to reshape one's facial bones to achieve an ideal V-shaped face shape. I obviously never experienced that, but physiologically, it seems quite brutal to have this sort of therapy where someone is literally attempting to almost fracture one's facial bones in order to achieve a smaller face shape. I do not think it is possible for the therapist using any sort of physical method to actually reshape the bones in a single session, as our adult bones are not malleable, they are all calcified. And what I have actually heard from people who have undergone that is that it's simply very, very painful. However, what we are aware of is that massage-treated skin explants express anti-aging dermal proteins via a process known as mechanotransduction with anti-inflammatory effects on the muscle nucleoporin, as well as what we term accelerated mitochondrial synthesis. Now, the mitochondria are essentially the powerhouses of your skin cells. In addition, marked morphological skin changes have been observed on 3D CT imaging post-facial massage, which directly relate to facial muscle relaxation and subcutaneous fat changes. And this has been shown to improve mid and lower face fullness with high levels of patient satisfaction rates, according to a 2018 study published in JAMA Dermatology. So yes, it is likely that participants do observe some changes in their facial structure after. However, I personally feel that one could be exposed to certain traumatic risks when undergoing this treatment. While I do not think it is very common to sustain a facial fracture from such a procedure, on top of the skin bruising, it's also possible to have fat necrosis due to the extreme amount of force that is exerted on the face. And if there is any sort of improvement from the treatment, it very likely would be arising from the effects of the massage itself. But massage does not need to have the amount of the great physical force it seems to be exerted during Golki therapy.
I see. Well, what about jade rollers?
Jade rollers have also been used for centuries in ancient China as an anti-aging beauty tool. Facial massage using a roller has been shown to increase blood flow by up to 25% for more than 10 minutes after the massage, which means that cosmeceuticals applied to skin after facial massage can be better absorbed. And besides that, regular facial massage improves lymphatic drainage and stimulates collagen production, which is why we recommend massage as an appropriate way to reduce scarring caused by surgeries.
Yeah, I've seen so many face slimming facials being advertised. How do facials make your face smaller?
Our definition of facials has to shift from the traditional mindset of undergoing a spa experience with a beautician performing extractions and massages to a medical facial whereby technology is used in dermatologist offices to exert a physiological effect on skin that improves the quality of skin, the health of the skin, and overall results in an anti-aging effect. Something that does indeed help to slim the face and has evidence-based, long-lasting results is a technology known as high-intensity focused ultrasound. What that does is essentially it targets the SMAS layer, also known as the superficial muscular aponeurotic system of the face, which is best envisioned as a curtain rail where the layers of your skin, the epidermis, the dermis, the subcutaneous fat, and the underlying muscles are all hanging on this curtain rail. So when you lift it up, and high intensity focused ultrasound can do that, you will be able to see a noticeable improvement of facial sagging, and your face will be more well shaped in the sense that it tends to reduce the roundness of your face, which has nothing to do with your facial bones this time. So if you have very broad facial bone structures, this is not going to help. But for individuals who may have a little bit more fat on their face, which is not a bad thing at all, because high food does result in fat necrosis, you will get a V-shaped sort of appearance when you perform this procedure, and your face will look smaller. Now, in terms of facials, with traditional facial massages, the benefit of massages are as what we had described before, but it really is not evidence-based in terms of being able to really slim your face substantially.
Well, what other alternatives are there?
The trend should be moving towards home devices modeled after in-office technologies. For example, radio frequency, something that is incredibly safe, is something that my team and I worked on. In terms of the FDA-approved radio frequency device that we launched in 2019, known as the Collagen Up Facial Wand. So this helps to tighten the skin via its action on the dermis. And overall, it leads to increased collagen formation and gradual shaping of a V-shaped face with microcurrent and the radiofrequency technology over a period of sustained use.
Moving on to our next segment on beauty faux pas, Dr. Teo, what do you think are the top beauty mistakes amongst Asian women today?
I would say that practicing in Singapore, the proportion of Asian patients that I see by virtue of our country's demographics is certainly greater than that of other races. I don't think that there are beauty mistakes specific to Asian women, but in general, I feel that one of the greatest misconceptions about beauty is that it's all about what you apply and the external treatments you can do. While all that is valid, and in dermatology, we advocate the use of a cosmeceutical skincare regimen and also effective aesthetic treatments such as lasers, peels, high-intensity focused ultrasound, radiofrequency. These all work at different levels of the skin, and there is definitely an effect. However, you have to understand that most aging occurs due to either environmental or biological factors, and it's very often a combination of both as well. We can't control the aspect of biological aging, and that is simply related to chronology. The older you get, you expect that there will be some level of age-related cell senescence, which is the gradual falling asleep of your cells of every single organ, including your skin, as you grow older. This is partly influenced by genetics as well. Lifestyle is a very significant factor in the aging concept. We talk about the skin aging exposome, which is directly related to one's lifestyle factors, such as the lack of sleep, disruption of the circadian rhythm, which means that instead of following normal daylight hours for your activities, you're a night owl. Nocturnal activity is simply not the way our body is designed to function, and all that will lead to disruptions, which the body then views as a form of stress. Furthermore, a poor diet is a significant lifestyle factor that can affect aging. We know that there are foods that are not beneficial for skin. For example, dairy. The foods which are beneficial are those who have high antioxidant content. In particular, we're talking about the content of polyphenols, which tend to be the highest in colorful fruits and vegetables. To neglect all of these lifestyle factors and nutritional aspects, in my opinion, is really quite foolish, especially when we've got the scientific data to back it up now.
Now we know all of these factors such as sleep, exercise, diet, and genetics that really contribute to skin aging. What about the examples we see in media of celebrities or influencers who make it seem so easy to have perfect skin? What are your thoughts on that?
I do come across some profiles of influencers or well-known individuals who seem to be showcasing their supposed superior genetics. They are obviously of a certain age and seems like they don't do anything at all and they boast about that or something really basic. Similarly, there are those who proclaim to have a head-to-toe makeover on a regular basis, where they claim that they don't need to lift a finger to exercise, and they are simply using all these cryolipolysis machines and aesthetic dermatology interventions and claim that that is the holy grail to anti-aging, the cheat sheet. One thing, though, is that no matter how diligent you are with these cosmetic procedures or even your skincare routine, if you continue to be sleep deprived, to sleep late, have a sedentary lifestyle, have weight issues, if you smoke and you have a poor diet, you will age faster than your contemporary who does take care with these lifestyle factors. By the way, this is likely to be as important, if not more, in my opinion, than your own genetic tendencies. So, in a sense, all is fair. You may think that a good-looking individual has won the genetic lottery, being born that way. But time and age, in this case, is a great equalizer. And that's when your day-to-day decisions and your hard work can affect the way you look.
Yeah, that's good to know. So, apart from a good diet and a good sleep schedule, is there anything else we can do to help improve our overall skin health?
I feel that the difference is really with an individual who is living a healthy lifestyle, which includes exercise. High-intensity interval types of exercises has been shown to be more effective in combating the aging process as opposed to other types of exercises. Dietary intervention as well will certainly improve the body function. I feel the biggest mistake is not understanding that all these lifestyle factors play a very big role. In terms of how well you respond to treatment as well, I find that my patients who are generally living a less hectic lifestyle, who incorporate a regular exercise regimen and have a nutraceutical-based diet where they are incorporating lots of plant-based antioxidants in their diet, they tend to have a much better response when we perform an intervention.
That's really insightful, and I think that our listeners will be fascinated to know that there are so many factors that all impact the health of our skin. Well, thank you all for joining us. Dermatologist Talks Science of Beauty is a podcast that keeps you updated on the various developing perspectives in the field of dermatology, skincare, and beauty-related topics. You may follow Dr. Teo Wan Lin on her Instagram at Dr. Teo Wan Lin, and remember to click on the subscribe button to stay updated on the latest episodes. We'll see you in the next episode.